I'm Heather Wilkins, and I manage a project called the Gender Services Project in Dundee, which has been going on for about 4 years now. I'm going to provide some background today, kind of the boring part, on what gender services are like in Dundee. And then I'm going to hand over to Jenna Lawrence here, who's the coordinator of our new Women's Hub, to talk more detail about the Women's Hub that we have. Right, so in 2018, the Dundee Violence Against Women Partnership began to review the pathways for women affected by violence and multiple disadvantage in the city from a kind of a whole systems perspective. And some of the key issues that came out from that review was a lack of resources to provide consultation to wider non-specialist services in the city, difficulty meeting the needs of women with multiple and complex needs, and also a lack of structured violence against women training and workforce development opportunities. And all of these meant there was going to be an increased pressure on the specialist women's services because the non-specialist services weren't able to meet the needs of the women that they were supporting. At the same time that review process was happening, a number of other transformation activities were going on in Dundee too. So a separate working group was set up by our ADP and the homeless strategic planning groups, and they were also looking at the needs of vulnerable women more broadly as well. And then at the end of 2019, you might be aware of the Dundee Drugs Commission report that came out. It was interesting that in this commission report, they had a clear message and recommendations around gender approaches. So recommendation 15 was purely focusing on women. And it said that ensure the needs of women who experience problems with drugs are assessed and addressed via the adoption of gender mainstreaming and gender-sensitive approaches to service planning. Also at this time, Dundee Women's Aid commissioned Dundee University to also look at the barriers that women were experiencing in Dundee. And this involved about 50 practitioners in the city and also about 35 women with lived experience. And clear recommendations came out from that report as well around services and responses to women and changes that needed to happen in order to meet their needs. And so this all resulted in what we call the Gender Services Group. And this Gender Services Group sits beneath the ADP and the Violence Against Women Partnership, so it's quite unique. It's a group that has representation from third sector partners, from statutory organisations and public sector. And they have a really good, strong voice across the sector and can influence a lot of other strategic groups in the city, which is really, really positive. But all this work, and with the research that took place as well, really supported our move forward to fund the Gender Services Project, which I support, which I work on. So this project works with services to help them understand better the different challenges and issues and needs that women have and how these are different because they are women. And how they can improve their services in order to engage better with women, particularly women facing multiple disadvantage. And the project aims to involve women with lived experience throughout its whole life cycle and ensure that every aspect is influenced by their experiences and their needs. So through the involvement of women in the Gender Services Project and voices from women working with other organisations in the city, we were able to crystallise the barriers that women are facing and highlight what works for the women too. And you'll not be surprised, because we've spoken about this quite a lot in a lot of the other presentations today, that stigma was a big part for women, that was a big part in the barriers that women face. We know that women who've been victims of gender-based violence in particular will experience really high levels of stigma. But we also know that women who take substances will also be subjected to increased levels of stigma as well. So women then feel embarrassed, ashamed, will have no confidence, might feel overwhelmed, and a lot of women will feel that they don't deserve any help. They may be controlled by their partner, they may have experienced sexual violence, and they may have so many appointments as well that they're having to try and juggle with to try and meet their needs. If they're mothers, they'll also be extremely afraid of the safety of their children, the fact that they may lose custody. So for reasons like these and many, many more that we've not covered, women are much less likely to engage with services. And when they do engage, the engagement can appear erratic. Women might be ambivalent, they might be aggressive, and then they might be compliant, but ultimately they will probably disengage. We also spoke to women about what works, and feeling physically and emotionally safe was something that was really important to them. Many women who take substances will have been victims of gender-based violence and will find it difficult to focus and engage when in the company of men. And so it's important that they can access a women-only space when they need it, so they don't feel judged or feel under threat. Women also spoke of how difficult it was for them to put their trust in someone, and we've spoken about trust a lot today as well. And they really, really valued relationships that they could build on trust, but that really does take a lot of time, and we've mentioned that today too. They also said they didn't want to have to keep repeating their stories to new workers and would like to see this change. So what did we do with all this information and time and energy that women in the city had given us? Well, with the Gender Services Project, we've co-produced a lot of resources with women to use with services. So we provided training to over 300 staff in the city so far, and we're working with lots of services at leadership level and at the front line. But all the resources that we use with these staff have been co-produced with women, and we've had around 30 women working with the project so far. And one in the corner there, which is it's a self-assessment form, which services can pick up and use and assess themselves as to where they are in taking a gendered approach. So they can then spot gaps in the service that they're providing, and they can have support from the project to try and fill those gaps. The Gender Services Group then applied to the Core Improvement Fund, with Dundee Razak being the lead partner for a women's hub. So that was a safe one-stop shop for women to access. It was really important that we created something that women wanted, and the voices of the women from the Gender Services Project and from our partners in the city fed into that. And it was really important, as they said, they wanted to see something that gave them a safe space. But it was really vitally important we had a strong partnership behind the bid, but also during the development of the hub and then being part of the hub once it's up and running. And so the partnership includes organisations like we have Dundee Drug and Alcohol Recovery Service, we have Hillcrest Futures, Dundee Women's Aid, Brooks Banks, TCA, Women's Criminal Justice Service, We Are With You, just to name a few, but there's many more other organisations involved. And some key dates on the screen, I don't know if you can really read them, but it was back in June 21 when we actually started this process. And it's taken quite a time to get here, but we're here now. And we were successful with a bid for 5 years funding for Dundee Women's Hub. And then, most importantly, we now have Jenna, who is a Dundee Women's Hub coordinator, who I'm going to hand over to now.
Hi everybody, so I'm Jenna Lawrence, so I'm the Dundee Women's Hub coordinator, and like Heather said, I was the most important part of this process. So if I just go back slightly, so it was really important when we were setting up the Women's Hub that we had a space that was trauma-informed, psychologically informed environment, but what we really wanted was a space that was not a clinical space or an office space. So the space that we have is a house, it's an old house, and that was really important to us because it's important that women felt safe and they did not feel that, you know, there was a label on the building that these women are coming for this issue. Anybody could be coming to this space. So getting ready to open, we held 2 co-production days with women with lived experience, and it was really important to us that they were the first people in the building before anybody else got to have a look. We'd try to use the feedback and the voices of what women have told Heather and through other organisations that are part of the partnership to get the building to the point where we could use it, but we knew that we needed ongoing and continued feedback from the women who would be attending the hub. So in these co-production days, we asked women about any practical changes that we needed to make to the space, what they wanted workers to know, what was important to them, any activities, services, groups that they would like to be in the hub. So luckily for me and to my relief, most of the feedback was really positive. We didn't need to do much selling of the Women's Hub, although there were some practical changes that needed to be made. We were able to do those, or that's an ongoing process. We had ideas ranging from making sure there were cuppa soups available, job done, there will always be cuppa soups in the Women's Hub, all the way up to creating podcasts. So there was a real range of activities that women wanted to take part in. In terms of what women wanted workers to know, it's a lot of what we've already spoken about today, and that was they wanted workers to know that language matters and that they needed workers to do what they said that they were going to do because they had felt really let down in the past. Before opening as well, for all the multi-agency staff that were going to be working from the hub, we held induction days for them, and that was really a bit like what we were speaking about today. How did we get here? What's the ethos behind the hub? What are our skills, our knowledge? We're all coming from different backgrounds. Some of us are coming from violence against women backgrounds, drug and alcohol use, psychology, welfare rights. There's lots of differences in what our backgrounds are, but we're all working towards the same goal of supporting women who have multiple disadvantages. And what was really clear from those sessions was that we were all trying to support women who were experiencing the same issues and overlapping issues. And we were all trying to firefight, essentially, but actually how could we all use our own expertise and work together to support women? So after this, we held our open day in the middle of August. I had absolute fear that morning because I thought no one was going to turn up. And it turned out over 300 people turned up, and I said the same spiel about 300 times. So that was really fun. And within that open day, we also gave opportunities to those attending to give feedback on the space and what they would like to see. So how is it going? So we've been open since about mid-August. This is an example of our timetable that we have at the moment. So over the first month, we have supported 27 different women over 49 occasions, and a lot of that support was multi-agency. So most of the women that we supported have had contact with at least 2 agencies in the hub. And we've had 61 visits from other organisations, either supporting women to attend or coming to find out more about actually what was going on and how do they feed into the Women's Hub, or how can we support them to support the women that are accessing their services. Just an example, a very quick case study. This is supposed to be Dawn. She wasn't very impressed by this picture actually, but that's all I could do. So Dawn is a 30-year-old woman. She has been open to lots of services over the course of her life. She was not long released from a custodial sentence, so she's maybe 6 to 8 weeks out of custody. Dawn has lots of trauma in her background, including domestic violence, sexual exploitation, drug and alcohol use, homelessness, the full lot of multiple disadvantage that we're talking about. And she came in one Thursday, and actually on that Thursday, she was able to get support from welfare rights to sort her universal credit out, to apply to ADP. She was able to get support from DDAS around her prescription and do some other psychosocial support around her current drug use. She got support from housing. We actually managed to stop her potentially getting evicted, so immediate crisis diverted. And she was also able to get support from RASAC around some safety planning. So she accessed 4 services within about 2 hours. So when I think back to this time last year, that would have been 4 different appointments to 4 different services that realistically wouldn't have happened. We all would have been trying to contact Dawn, probably on old numbers that don't exist anymore. That phone's well gone. It's not there anymore. But actually, what Dawn told us, so when I told Dawn that we were going to be speaking about her here, I asked her what she thought about that situation, and she said that she just felt relief. She felt relief that she was able to come to the hub and get that support. She didn't need to keep continuing to tell the story 4 different times, and there's now a pretty clear plan in place. And since that time, Dawn has been able to come and get some more support from the hub too. So that's what it can look like when it works. But it's not always that easy. So there has been challenges. That picture says, what if we don't change it all and something magical just happens? It also has profits behind it, which is why none of us are here, because we wouldn't be here if that was the case. So the challenges are, this is a new way of working. It's bringing people together and organisations together who, although we all will work together across various partnerships, we're not usually in the same physical space. We all have different funding outcomes that we need to meet. How do we work together in this way? So that has been difficult, and it's also, it's commitment from organisations that they will turn up when they say they're going to turn up. I think it was the second speaker that said, one bad review or one negative comment outweighs 10 positive ones. So we need to be consistent in the way that we're approaching women. We need to do and say what we say that we're going to do. Staff burnout, I think, in this field is very high, and that's always a risk. But the idea behind Women's Hub is that we will support each other. The services need to support each other to lift each other up, even as having a point of contact in another organisation and being able to phone and say, I don't know, can you help? What do you think about this? We can't all be experts in everything. We can't be, but we can have points of contact that are supportive around that. And the third challenge, I think, is really constant review and change. I'm very much if it's not working, let's change it. And I think that makes people feel uncomfortable because it's not set in stone. Like the timetable that I showed you guys the slide before, it won't be the same as that after Christmas. We'll change it because some things will work and some things won't. And we need to be able to have those open conversations to say, that's not working, and put egos aside. It doesn't mean that somebody's failed. It means that this approach that we're doing, this agency being in it at this time, it's not working. So how can we make it work? Let's be solution focused. And lastly, what's next? So our plan is to have ongoing opportunities for women to be involved in the continuing development of Dundee Women's Hub. So that might be through taking part in activism. So every November into December, we have 16 days of action against gender-based violence. We have a Reclaim the Night March, I think it's on the 27th of November this year in Dundee. So can women who either don't, can, won't usually take part in it, can we get them to take part in some activism? Can they be part of that collective voice that can be really empowering that they maybe don't get a lot of in the rest of their life? We've offered women opportunities as small as, we're going to paint a room a different colour based on feedback. What colour do you like best? Can you vote on that? All the way up to wanting to create a women's panel that would sit alongside or be part of our Women's Hub steering group. So all those different forms of women taking part and having a voice, how do we develop that? We also want to increase access to services. So, for example, today, the Health Inequalities Nursing team is going to start working in the hub every Wednesday afternoon. Are there other organisations that could be part of it? How do we make that work? And lastly, upskilling between services. Like I said, we can't all know everything, but is there things that, like staff being trained up in BVV testing, is there other bits and pieces that we can all upskill from each other? It's not us taking away those specialisms, but actually, can we have no wrong door, no wrong person approach where any woman can come in and get the basics from each person that's working there? And lastly, like I said, that timetable probably won't even be the same in 4 weeks' time, but that's what we're working on. And lastly, for Heather, for the Gender Services Project, that project will be moving on to look at women's health, so that is sexual health, mental health, GP shared care, pharmacy and pain management. So it's really looking at what women's experiences are. It's hard enough for a lot of us here who are used to advocating, standing on a stage, and you can still speak to a doctor and be like, I'm sorry, I don't know. But so how hard is it for somebody who's not used to advocating for themselves or not feeling like they're believed or listened to take part in those processes? So that's what we're working on. This is our contact information. The hub is on Instagram and Facebook. We post updates and our timetables and things there. Thank you for listening.